And so up until I reach the level of fitness in terms of strength, cardiovascular endurance, and the very, very vain aesthetic, so how you look in front of the mirror, I will not consider myself fully rehabbed until I reach those levels that I once had prior to that. What up, everyone? It's been a minute. I'm sorry that I haven't been uploading here. I have my reasons. I will get into them. First and foremost, what's up? There you go. Took a little time to get started there. Compare that to that. Those are the aesthetics. Check it out. Oh, front double bi. Can you see that? I don't even know if I did that right or if that's what that's called. I'm not a bodybuilder, guys. Welcome. Sorry that I've been an MIA. I have been studying for my board exam. Those of you who've been following along since my first video know that I'm currently finishing up dental school, and this last exam was huge. It was my licensing exam, and so I kind of went 0 dark 30 and just shut off from the world, YouTube included. I'm sorry, I still tried to manage and respond to comments that you guys were leaving for me and questions. When it comes to work-life balance, I devote all my attention and time and focus onto one thing that I'm doing, and it takes away from other things which could be viewed as not healthy, but it's worked for me ever since my undergraduate degree, worked all throughout dental school. And so in my mind, why fix something that isn't broke? But here we are, we're back, we're on the other side of the exam. Now we got nothing but time to rehab this thing to completion. So some things I want to speak of today in this video will include what workouts I'm doing, how they are going to change now that I'm in week 16 moving forward. I want to talk to you guys a little bit about whether or not I feel like I made the right decision at this point in time when it comes to surgery versus non-surgery. I made a video about it in the past, but that was like 1 or 2 weeks post-surgery. So I want to speak to you guys about my rehab process. I know I'm 16 weeks post-surgery, and in the eyes of your ortho, in the eyes of your physiotherapist, you should technically be rehabbed. And lastly, I want to talk to you guys a little bit about how the injury might have happened. I was speaking to one of my friends who happens to be a physiotherapist as well, and he described this type of injury, not necessarily a distal bicep tendon, but any tendon injury that he sees a lot in his clinic. And so he explained it to me very well, and I want to do the same thing for you guys. That way, moving forward, we can kind of be aware of certain types of injuries and how to stay away from them, or even just educate our friends. All right, so first, workouts. Up until my last video, I think you guys have been following along, been pretty transparent with what I'm doing. A lot of it was laid out by Dr. John Petrizzo. And so it was the same thing. I wasn't changing it. I was just following his instructions to a T up until the 12-week mark. The 12-week mark is kind of when he like re-releases you into the wild.
You okay?
Yeah, I'm good. I'm just gonna go and check my mail over there.
You been lifting weights?
No, I don't think it.
He gives you the foundation from 6 to 12, which I've discussed in my past videos. And then after 12, he kind of just says you're free, you should be good, and you can get back to what you were doing. Take that and combine it with the fact that I was studying for this board exam. My last 3 weeks, I guess, were a little bit in limbo. I wasn't programming my workouts. I was kind of just going into the gym to build up a sweat, shake off the fact that I've been sitting for the past 10-12 hours in this position, working in someone's mouth or studying, like just going through theory. And so I'd go to the gym, I would just pretty much continue doing what Dr. John Petrizzo said, slowly adding in more dumbbell work, less machine work, slowly getting back to what I was doing in the past, but nowhere near the same level of intensity or focus that I had. And that was for multiple reasons. One, I didn't want to be tired the next day or fatigued, especially for this thing. Two, I was still a little bit worried about re-rupture, and being so close to my exam, I didn't want that to happen. I didn't want to go into my exam with injury to my arm. It is my dominant side, and I use it a lot in practice. And so those two combined, I backed off the gas pedal a lot in my last 2-3 weeks. I even stopped going for runs. So runs for me was a very, very good way to clear the mind. And I think it was the fact that I was staying seated for so long, and that when I would go for a run, I would start getting knee pain. And I didn't want knee pain when I was in the clinic, so I stopped running completely, which probably wasn't the best idea, but it's what I did. And so I went for a run this morning. I'm gonna start incorporating those again. Try to go for at least 2 to 3 a week. Try to hit zone 2. Try to hit it more as of a recovery run, but still getting your endurance in. And so that'll continue alongside this new workout that I'm going to implement. And so I spoke about it earlier, but I feel that even though we're technically rehabbed, and that's the guy right there, you have the strength, your muscles firing, you have the mobility, you have the range of motion everywhere. You're no longer compensating with your shoulder, dumping your shoulder forward, or using the flexors of the forearm to lift. Like, everything is good, right? At this mark, at this point in your rehab schedule, you're probably not 100%, but you're damn well near close. And so your physio, your ortho, everyone will kind of give you that thumbs up, and you're on your own. You're back out there. You're back to being a normal human. But in my eyes, I'm still not rehabbed to the point where I was prior to the injury. And so up until I reach the level of fitness in terms of strength, cardiovascular endurance, and the very, very vain aesthetic, so how you look in front of the mirror, I will not consider myself fully rehabbed until I reach those levels that I once had prior to the injury. I will upload my progress through YouTube as well. It's a nice little metric to have and show you guys if you are in the same boat. And so I'll lay out my workouts. I will lay out my cardio. I will even go into as much as diet. I know that's a very taboo subject. Everyone has their own take on diet, but I will include what I'm doing for myself and what works in the next little series of videos here, and you guys can all follow along if you also feel like this injury has affected the rest of your body. So, surgery versus non-surgery. I made a video of this in the past, and it kind of sounds like I'm dividing the groups into like teams, like the people who went for surgery versus the people who didn't go for surgery, and like putting them against each other. And that's not what I'm trying to do. If you watch my first video, I strongly considered the conservative therapy. I was very scared of nerve damage, complications. I mean, no one wants to lose an arm, right? Like, I'm not saying that some people out there are willing to roll the dice. For me, what I thought of was all of my schooling, all of the time that I've kind of just devoted to my future would just be erased if I ended up having nerve damage in my right arm. Because, yeah, I don't know about you guys, but I haven't heard of any one-arm dentist. Maybe I could have been the first. Social media these days, you never know. But I strongly considered the non-surgical therapy for this. The only thing that flipped the switch or tipped the scales was the fact that fatigability was shown across the board to be better in those that underwent surgery. So first and foremost, I want to say that I am fortunate enough to be able to have the choice between surgery and non-surgery, right? So certain people don't have that choice, whether it's dealing with financials because surgery is expensive, if it's any outstanding health conditions that may limit them going under general anesthesia, or complications that may arise during the surgery, right? I was cleared for surgery when it comes to like medical conditions, so I'm fortunate in that way. And also the fact that I have a support circle around me that was able to care for me during the first 2-3 weeks of surgery, either through care aid or financials. And so I'm very happy, very lucky that I was able to have the choice between the two. Some people out there who were watching videos or trying to collect information might not have the same opportunity to choose between the two. So for everyone who's watching this that underwent surgery, you're fortunate enough to be able to have that choice, and I think you should be grateful for that. So some things that led me down the non-surgical route more towards the beginning of this whole rehab process was the fact that no surgery, so there's no complications when it comes to nerve damage, infection, or the fact that you're going to be wearing a plaster cast, that you won't be able to shower. Sorry, that's my dog. Also, you're able to start strengthening right away. Like, I was pretty adamant on staying active throughout the entire rehab process, but I think the blueprint is you're not supposed to start loading the muscle, and you're not supposed to be doing any physical activity for the first 6 weeks. And so your job during non-surgery is just to strengthen the surrounding muscles, and you can do that almost immediately. And so for me, that was a huge selling point, right? Because at that point of injury, I was training for my first ever marathon. I think I was already a month and a half in. I knew that my board exam was coming up in May. And so I always had the thought in my head of what if I ran into complications down the line with surgery. I also knew it takes a longer time to get back to daily activities. That's one thing that you're always going to hear and read about. If you pick surgery, it'll take longer to come back to normal daily activities. And so that thought in my head was like, what if it starts affecting my board exam coming up? That was very, very stressful, because this board exam determines whether or not I can work as a licensed dentist. And lastly, I was just starting up a little personal training, boxing, one-on-one consultation kind of thing, where I would hold pads for people and charge them by the hour. And so going through surgery, that's completely gone. Like, that's non-existent. You can't do that. But like I said, I had a support circle that allowed for me to make the decision of not doing that. And the way I factor it all in, and maybe you guys did the same, was that all of the things I listed just now, the marathon training, the fact that if I might not be able to perform as well on my board exam, the whole business startup when it comes to personal training and boxing, all of those were very short-term goals. Like, okay, I miss out on the marathon, I can do it next year. If my manual dexterity isn't there due to the surgery and I can't study and perform on my exam, I can always take the retake. And this boxing business, it'll be there for when I recover. And so they were all very short-term goals in my mind. And I just had to remind myself of that this injury, or this choice of going through surgery versus non, is a lifelong decision. And so in my mind, and I've kind of always been under this thought process of delaying short-term gratification. And so for those three things, amongst others, but those are the three main points that I wanted to use as an example, I just viewed it as delaying short-term gratification for something that'll pay off better in the end. I am very happy with my decision.
And what is this one?
Oh, this? That's my credo. No regrets.
You have no regrets?
Dad?
No? Like, not even a single letter?
I didn't have any complications. I felt like I rehabbed this very quickly. And again, this is something that I think that you're not going to notice a big difference with up until years later. And so at the 16-week mark, if I'm happy now, I know I'll be happy in the future. I know that that's when the dividends, that's when you'll start collecting on your investment, right? The first couple weeks you won't. You'll hate it. You're in a cast for 2 weeks, you're showering, you can't work out, you're sweating in this thing, you can barely sleep because you have like a cinder block attached to your arm. You have to sleep like a vampire. It's just the worst. You feel like you made the worst decision. But again, delay short-term gratification for long-term gain. And that's how I feel about this. It's the mentality that I have with most things in my life. And so that's a little update on surgery versus non-surgery and how I feel about it. And you guys can let me know whether or not you feel the same depending on where you are in your rehab process. I'm almost positive that everyone who's watching these videos have undergone the surgical therapy, but if you're one of those people that have not, please shed some light. Let me know whether or not you feel like I made the right decision or if I'm missing anything. All right, last little point I want to touch on, and this is something that I found very interesting and I agree with completely. I'm a man of science, and if someone explains something to me using physiology, biochemistry, anatomy, I'm there. So I was hanging out with one of my friends who happens to be a physiotherapist, and we were talking about the injury. It was actually at a birthday party, so there was a lot of alcohol going around, and this is why the topic got brought up. And so we were all drinking. It was a buddy's birthday, and we were all enjoying the night, and we started talking about the injury. And he told me, he's just like, I see so many tendon ruptures coming in through my clinic, and it's always the same story. It's always after a layoff. So they're like normally healthy people, active people, who have some sort of layoff or some sort of event leading up to the injury where they can pinpoint at a time when they were dehydrated. And so the way he explained it to me was, what happens is for most weekend warriors, Friday off, go out, party with their friends, have some drinks, and then end up dehydrating themselves or waking up the next morning with a hangover, right? That's basically your body telling you that your brain is dehydrated along with the rest of your body. And nurse that hangover all of Saturday, and then wake up Sunday morning feeling good, but feeling good enough to start doing physical activity. We all know that the tendons and ligaments in the body have a very, very bad blood supply, which is why they also take forever to heal, because the exchange of nutrients, the building blocks, removing of toxins and metabolites happen at a slower rate. And so the same thing can be said about dehydration. So when you drink Friday night, your body will pull intracellular fluid from all of your tissues and you'll piss it out. Alcohol is a diuretic, right? We all know this. And so you wake up the next morning, you have a crushing hangover. It's because of the intracellular fluid in your brain has dropped. And you also, if you try to work out that day, you'll feel like shit, one, because you won't have the hydration in your muscles, but you'll also cramp up faster. And those are two metrics that we can use to gauge whether or not the tissues in our brain and our muscles are hydrated. We don't have a metric or some sort of feeling to know whether or not our tendons are rehydrated. And so this is where it gets a little tricky, because when we rehydrate on that Saturday with water, electrolytes, whatever have you, we start replenishing the liquid and water in our muscles and in our tissues. But because the tendons and ligaments have such a poor blood supply, they're the last to be rehydrated. Meaning that come Sunday, if you feel like you're good to go and you feel fine, your muscles are rehydrated, your brain's rehydrated, everything is good, your tendons still might not be. And so that is when you put yourself at a higher risk of injury. And this made sense completely. And so that's it, guys. That's the video for today. I'm sorry again that I've been MIA for a while, but I'm back now. I will continue to upload videos once a week dealing with the rehab, even though I feel like it's good now. And so I'll keep you guys updated with that. And I'll see you guys on the next video. Adios.